Stomach and digestive conditions. Indigestion, dyspepsia. Discomfort or pain in the upper abdomen often associated with difficulty digesting food, and it can result from various causes such as overeating, certain foods, or underlying digestive conditions. Example, after a heavy meal, Sarah experienced indigestion, characterized by bloating and discomfort in her stomach. Diarrhea, passage of loose or watery stools, often a result of infections, food intolerance, or gastrointestinal disorders. Example, Mike's diarrhea, following a trip abroad, was likely due to a gastrointestinal infection. Constipation, infrequent, difficult, or painful bowel movements are often associated with hard stools. Example, Lisa's diet lacking in fiber led to persistent constipation, prompting her to increase her fiber intake. Heartburn, acid reflux. A burning sensation in the chest caused by stomach acid flowing back into the esophagus. It's a common symptom of gastroesophageal reflux disease, GERD. Example, John often experienced heartburn after meals, prompting him to elevate the head of his bed to alleviate symptoms. Gastroesophageal reflux disease, GERD, chronic condition where stomach acid regularly flows back into the esophagus, causing heartburn and irritation. Example, Samantha managed her GERD with lifestyle changes and medication to alleviate acid reflux symptoms. Gastrointestinal reflux, GER, similar to GERD but less severe, involving occasional backward flow of stomach contents into the esophagus. Example, infant GER is common and often resolves on its own without causing significant discomfort. Hemorrhoids, swollen blood vessels in the rectum or anus, cause discomfort and bleeding during bowel movements. Example, David sought relief from his painful hemorrhoids through dietary changes and over-the-counter medications. Irritable bowel syndrome, IBS. Functional gastrointestinal disorder characterized by abdominal pain, bloating, and changes in bowel habits without apparent damage to the digestive tract. Example, Mark's IBS manifested with alternating bouts of diarrhea and constipation during stressful periods. Gastritis, inflammation of the stomach lining, often causing discomfort or pain. Example, Mary's gastritis, brought on by stress, resulted in burning sensations in her stomach. Gastroenteritis, inflammation of the stomach and intestines, typically caused by viral or bacterial infections. Example, the outbreak of gastroenteritis in the community was traced back to contaminated water. Hiatus hernia. A condition where a portion of the stomach protrudes into the chest through an opening, hiatus, in the diaphragm, potentially causing acid reflux. Example, Maria's frequent heartburn was attributed to a hiatus hernia, which was diagnosed through imaging studies. Peptic ulcer, a sore that forms on the lining of the stomach or duodenum, often due to bacterial infection or prolonged use of NSAIDs. Example, John's peptic ulcer caused him sharp pain and required medication to heal. Lactose intolerance, the inability to digest lactose, a sugar found in milk and dairy products, leads to digestive discomfort. Example, Amy managed her lactose intolerance by choosing dairy-free alternatives to avoid digestive issues. Celiac disease, an autoimmune disorder where ingestion of gluten damages the small intestine. Example, Emma diligently avoided gluten-containing foods to manage her celiac disease and prevent intestinal damage. Malabsorption, inability to properly absorb nutrients from food, often associated with conditions like celiac disease or pancreatic insufficiency. Example, Tony's malabsorption issues led to nutritional deficiencies, requiring dietary adjustments and supplementation. Inflammatory bowel disease, IBD, chronic inflammation of the digestive tract, including conditions like Crohn's disease and ulcerative colitis. Example, Sarah underwent treatment to manage the symptoms of her inflammatory bowel disease. Diverticulitis, inflammation or infection of small pouches, diverticula, that can develop in the walls of the colon. Example, James experienced severe pain during a diverticulitis flare-up and required antibiotics for treatment. Gastrointestinal motility disorders, conditions affecting the movement of food through the digestive tract, cause symptoms such as bloating, constipation, or diarrhea. Example, Mark's gastrointestinal motility disorder resulted in irregular bowel movements and discomfort after meals. Gastrointestinal obstruction, blockage in the normal flow of food or liquids through the digestive tract, which can lead to severe abdominal pain and vomiting. Example, Tom's gastrointestinal obstruction, caused by a twist in his intestine, required emergency surgery to alleviate the blockage. Gastrointestinal bleeding, the presence of blood in the digestive tract, often indicative of an underlying issue such as ulcers, inflammation, or tumors. Example, Martha's persistent gastrointestinal bleeding required diagnostic tests to identify the source and initiate proper treatment. Cholecystitis. Inflammation of the gallbladder, typically caused by gallstones blocking the bile ducts. Example, Carol's cholecystitis resulted in severe pain and discomfort in the upper abdomen, necessitating gallbladder removal. Pancreatitis, inflammation of the pancreas, usually causes abdominal pain and digestive problems. Example, Steve's acute pancreatitis required hospitalization and a temporary change in his diet. Gallstones, hardened deposits form in the gallbladder, often causing pain and potential blockage of bile ducts. Example, Rebecca's gallstones necessitated surgical intervention to relieve her symptoms. Esophagitis, inflammation of the esophagus, often caused by stomach acid backing up into the esophageal lining. Example, Robert's chronic heartburn eventually led to esophagitis, causing pain and difficulty swallowing. Gastroparesis, delayed emptying of the stomach, leading to symptoms like nausea, vomiting, and bloating. Example, Sophie's diabetes contributed to the development of gastroparesis, affecting her stomach's ability to move food efficiently. Appendicitis, inflammation of the appendix, a small pouch located in the lower right abdomen, often requires surgical removal. Example, Emily experienced intense pain, and the diagnosis revealed acute appendicitis necessitating immediate surgery. Gastric cancer, cancerous growth in the stomach lining, potentially causing symptoms like abdominal pain, weight loss, and nausea. Example, Paul's diagnosis of gastric cancer prompted immediate medical intervention and treatment planning. Several stomach and digestive conditions can potentially occur after surgery, and they may vary depending on the type of surgery performed. Here are some post-surgical conditions related to the stomach and digestive system. Postoperative ileus, temporary impairment of normal bowel function after surgery, leading to a slowdown or halt in the movement of the intestines. Example, following abdominal surgery, Mary experienced postoperative ileus, resulting in bloating and delayed bowel movements. Dumping syndrome. Rapid emptying of the stomach contents into the small intestine, often occurring after certain types of stomach surgeries. Example, after gastric bypass surgery, John developed dumping syndrome, experiencing symptoms like nausea and rapid heart rate after meals. Adhesive bowel obstruction. Formation of scar tissue, adhesions, post-surgery, causing a partial or complete blockage in the intestines. Example, Carol underwent surgery for abdominal issues, but later developed adhesive bowel obstruction, requiring another surgical intervention. Anastomotic leak. Leakage of contents from a surgical connection, anastomosis, between two parts of the digestive tract, often requiring immediate medical attention. Example, Tom experienced an anastomotic leak after his bowel surgery, leading to infection and abdominal pain. Short bowel syndrome, insufficient length of the small intestine, often due to surgical removal, leading to challenges in nutrient absorption. Example: following extensive bowel resection, Sarah developed short bowel syndrome, requiring nutritional support and monitoring. Gastrointestinal fistula. Abnormal connection between different parts of the digestive tract or between the digestive tract and other organs, leading to leakage of digestive fluids. Example: Mark's surgery resulted in the formation of a gastrointestinal fistula, causing drainage of stomach contents into the abdominal cavity. Gallbladder issues after weight loss surgery. Some individuals may develop gallstones or other gallbladder problems after certain weight loss surgeries. Example: after successful weight loss surgery, Ginny experienced gallbladder issues, necessitating the removal of her gallbladder. Delayed gastric emptying, gastroparesis, impaired stomach emptying, can occur after certain abdominal surgeries. Example: Bob developed delayed gastric emptying after his abdominal surgery, experiencing persistent nausea and vomiting. Reflux after hiatal hernia repair, recurrence of gastroesophageal reflux, GERD, symptoms after surgery to repair a hiatal hernia. Example: despite successful hiatal hernia repair, Lisa continued to experience reflux, requiring ongoing management. When sick, stick to a bland brat diet: bananas, rice, applesauce, toast, hydrate, rest, avoid spicy foods, and seek medical advice if needed.